Let's now go on to the next speaker, Dr. Dott Secreto, and he'll be talking to us about circulating steroid levels in menopausal breast carcinoma. Well, congratulations to all of you who have endured this very long and somewhat challenging program. Before starting, I'd like to thank Dr. Lafranchi in particular for inviting me along to this very important meeting, although my lecture probably strays rather far from the topics dealt with on today's agenda. I'll be talking to you. Couldn't I have a mic, please, so I can move around? That's better. I'll be talking to you, as I said, about the role of sex steroids in breast cancer. And obviously, it all starts with estrogen. Estrogens are universally acknowledged as the promoters of breast cancer. They play a fundamental role in this disease, and the presence of estrogen receptors
una prova inequivocabile di ormonodipendenza della malattia, viene utilizzata abitualmente nella pratica clinica per indirizzare le pazienti verso efficaci terapie con farmaci antiestrogeni o antiaromatasici. In apparente contrasto con il dominante ruolo degli estrogeni nel cancro della mammella, la teoria iperandrogenica concepita e sviluppata nel nostro laboratorio
in our laboratory over the past 40 years suggests in excess androgen statuses the role of this disease. Do you have to go by? So according to the theory, androgen excess is the endocrine abnormality characteristic of women with breast cancer, stimulates cancer development either directly or after conversion into estrogens. So to further investigate the role of sex steroids in breast cancer, we conducted a study on 491 postmenopausal women with breast cancer. We examined the association of hematic levels, blood levels, of testosterone and estradiol with age, body mass index, and certain selected tumor characteristics. And in my presentation today, I'll be only looking at the associations between circulating levels of sex steroids and tumor size, and with the estrogen receptor contents of the tumor. We can skip that one. Now, this chart presents the odds ratios of tumor size by estradiol tertiles. Tumor sizes were divided into two categories, equal or above 2 centimeters or below 2 centimeters. And you can see that we also have it's also possible to see that the odds of having a tumor larger than 2 centimeters in size increases with the levels of estradiol from 1 to 156 to 3.02. It's also possible to see that the association is not all changed by body mass index. There's no relationship with body mass index, and only slightly so by testosterone levels. Similarly, when we assess tumor size by testosterone tertiles, we can see that the likelihood of having a tumor size of more than 2 centimeters increases progressively with the higher levels of testosterone. And again, the association is not influenced by body mass index, nor is it much influenced by estradiol. These results indicate These results indicate, or would suggest at least, that estradiol and testosterone are two independent stimulators of tumor growth. Obviously, they support the theory of the hyperandrogen theory, because at least part of some tumors are directly stimulated by androgens. What we've discovered is that there is a strong link between circulating testosterone levels and the presence of estrogen receptors within the tumor. In contrast with the very weak association that we detected between circulating estrogen levels and the presence of estrogen receptors. This slide shows the odds ratio for the ER status by estradiol tertiles, ER status positive versus negative, and in the first line, you have the 491 patients as a whole, and you can see that in fact the odds of having an estrogen positive tumor increases with the high levels of estradiol from 1124 to 186. The association is, however, somewhat weak. If we then look at the next line, here we're looking only at patients in whom the body mass index was known, and this somewhat reduces the number of the sample, the size of the sample. You can see that the association does persist, but is not statistically significant, and the association is not mediated by body mass index, and it is influenced strongly by testosterone. In this slide, we have the odds ratios for the receptor status by testosterone tertiles. You can see that the odds of having a tumor ER status positive increases with the increased level of testosterone, and it's also possible to see that the association is not influenced by body mass index nor by estradiol. The association between testosterone levels and estrogen receptors that we found in our study fits in rather well with data published in the literature on prospective trials in healthy women, showing that the risk of developing breast cancer that's ER positive increases significantly in women who had high levels of testosterone. And